The first surprise that you realize as a physician and you step out of clinical practice is frankly how little you know. And it hits you, and certainly hit me like a ton of bricks. Really understanding the business of medicine. Like, you don't get, at least in the mid 90s when I was in medical school, you don't get taught about the business of medicine. You don't get taught about health insurance companies. You really don't get taught about life science and practice, right? You are so egocentric from a provider point of view that you really don't know what else is going on. So the first big surprise was really the business of healthcare outside of clinical practice. The second, especially as I started to consult and I watched 22 and 23-year-olds run circles around me in PowerPoint and Excel files as part of that, I just realized how little I knew actually about consulting in that space, and had no idea. And I think part of what I have tried to hold on to is an immense amount of humility and embrace vulnerability as part of that. And it started then. Again, I had no idea what I was doing. I was more senior from a title standpoint than lots of people who were much better prepared to do the work than I was. And so I had to ask a lot of questions. I had to ask for help a lot and had to learn really quickly as part of that.